So welcome, everyone. We're very happy that you could join us for this event. We have a full day of very interesting presentations and talk about program science. It's an exciting time for us.
So the science of program science, if you're trying to just distill it down to key components, there are key program and community questions or observations that are made probably on a daily basis. And at some point you get together and you say, okay, what are some clear research questions or hypotheses that we can generate based on what we're observing, based on the questions that we have sort of kind of in general? Come up with the best and feasible tools. And the feasible is important, again, from the modeling perspective. And then you go about it, you answer these questions, and they inform your program planning, implementation, and management. They don't necessarily just inform, but they're actually part of that whole process.
Implementation science is multidisciplinary, right? It's transdisciplinary. You need a lot of different types of people involved in this work for it to be meaningful. And then, obviously, engaging community.
The importance of community engagement and a participatory approach has been recognized within program science. Such an approach promotes the integration of researchers, evaluators, and services users into community intervention and public health efforts, and allows practice to inform science and vice versa.
So it's really thinking about when you're looking sort of at the elephant in a room and one person's looking at the trunk and one person's maybe looking at the tail and one person's looking at the foot, it's about how to bring it all together so that you recognize that what you're dealing with is an elephant and not just one aspect.
You can ask questions about the relation between your intervention as a whole and the effects, okay? Are the effects I observed linked or due to my intervention? And this is effect analysis. As evaluators, we can have a judgment on the whole intervention. An intervention can be a policy, can be a drug, can be a program, okay? Or we can have a judgment on various components or on the links between those components. And then you have implementation analysis, which has what works in which context and what makes my intervention work and what are the difficulties?
It's trying to recapture the importance of evidence, but to actually work it and use it and challenge our thinking. I really think core questions are who uses that systematically produced information, how is that information actually used, and more importantly, and now coming back to the topic of community-based evaluation, is whose questions are we asking and answering in evaluation? And who is an issue of power.
The pace of technological innovation and the pace of discovery, especially in healthcare, has been so rapid and so fast over the last 25 years that if we were to implement everything that's out there, that works, that's quote-unquote beneficial, we would have no money left to spend on anything else. But the problem from the economics perspective is that if you have something that costs, let's say, $10,000, and in one case it reduces tender joints by 20%. And alternatively, if you spend it on an HIV drug, it reduces your plasma viral load by a certain amount. Or if you spent it on your asthma medication, it improved your FEV by 20%. Which 20% is better?
So the WILLOW intervention, it stands for Women Involved in Life Learning from Other Women. It's a prevention intervention targeting positive heterosexual women between the ages of 18 and 50. It's a pretty neat, I'm not going to talk a lot about it right now, but it's a pretty neat intervention. It works, they work in peer groups, facilitated through 4 sessions. They talk about healthy relationships, in negotiating condom use, power relations, these sorts of things, as well as sort of technically how to properly use a condom and some sort of some HIV information.
So when we talk to OST and they sent us, like David said, a couple of interventions that would work with what we're thinking would work out with our programs. We have HIV prevention programs, and we also have programs for women living with HIV. So out of the various interventions they sent us, we chose 2 one, which was Willow, and we chose Willow because it aligned with the programs that we do with women living with HIV, but we also chose it because some of the issues that were covered in Willow were topics of interest that women always brought when we were having groups within the center, with negotiating safer sex, talking about unhealthy and healthy relationships, and also coping skills as a woman living with HIV. And we also chose it because we are in the process of integrating HIV disclosure models within organizations. So we thought these topics will really be helpful for women who actually plan to disclose their HIV status.
By looking into the data that we had, we were able to identify multiple. At one time, we had 40 concurrent quality improvement processes going that we're really working across the continuum of care in order to try to improve outcomes and change the course of the epidemic.
I think there's lots of opportunity in pushing forward this program science agenda for us to collaborate from different disciplines, and in some ways, you know, we are all in the same discipline of kind of evaluation and implementation.
No, I mean, I think that the world, for example, is not focused on, like, does PrEP work in pre-exposure prophylaxis for the prevention of HIV acquisition among gay men or MSM? You know, that is no longer the question. The question now is, like, you have something you know works, what are you going to do with it? It's the first new thing since, like, the condom. You know, what are you going to do with it? How are you going to implement it? In what places? In what centers? Who's going to pay? I mean, those are the relevant questions.